Welcome to Psoriasis on YouTube. We cover all things psoriasis on this channel. If you have psoriasis, you may be concerned about how COVID-19 will affect your health and treatment strategy. Fortunately, since early 2020, scientists have learned a lot about coronavirus, the virus that causes COVID-19, and how it affects many health disorders, including psoriasis. The good news is that most evidence suggests COVID-19 poses low additional hazards to persons with psoriasis. This includes persons with psoriasis who are taking medications that influence the immune system's function. COVID-19 risk in psoriasis. Coronavirus has been found in humans all around the world. The possibility of getting COVID-19 and consequences in an immune system that is already vulnerable is a worry for persons with chronic health disorders like psoriasis. What is known is that adults over the age of 65, as well as people with chronic medical illnesses such as heart disease, diabetes, lung disease, and renal and liver disease, are most vulnerable to getting COVID-19 and becoming very unwell. While the Centers for Disease Control and Prevention, CDC, does not list psoriasis or other autoimmune disorders as being at high risk for COVID-19, many persons with psoriasis may have additional comorbidities that put them at increased risk. Infections, including as respiratory infections and pneumonia, are also more common in people with psoriasis than in the general population. People with severe psoriasis are at an even higher risk. According to a study published in the British Journal of Dermatology in 2021, adults with psoriasis had a 36% higher risk of infection and a 33% higher risk of infection-related death. This risk exists both with and without comorbidity variables, existing conditions. Overall, the researchers discovered that patients with psoriasis were more likely to develop COVID-19 than the general population. The number of patients with psoriasis who contracted COVID-19 was 33% higher than the number of those without psoriasis who also contracted the virus. Controls. COVID-19 symptoms in psoriasis. COVID-19 symptoms that you might have if you have psoriasis are the same as they are for everyone else who has COVID-19. Fever, body aches, cough, weariness, chills, headache, sore throat, and loss of smell or taste are the most prevalent symptoms. More severe symptoms, such as a high fever and shortness of breath, may occur in some patients. If you've been exposed to COVID-19, you'll see symptoms in 2 to 14 days. Psoriasis complications and COVID-19. If you test positive for COVID-19, experience symptoms, or believe you have been exposed to the virus, contact your primary care physician right once. Tell them you're using immunosuppressive medications to treat your psoriasis. If you test positive, you should also contact your psoriasis doctor so that they can advise you on how to manage your psoriasis care while you heal. They may advise you to adjust or postpone your next dose of immunosuppressive medication. During this time, your doctor will also inform you about treatment options for preventing a flare-up, a period of increased disease activity. There isn't enough research to know how COVID-19 affects people with psoriasis or whether they are affected differently than people who don't have the disease. COVID-19, on the other hand, is highly transmissible and spreads quickly, putting everyone at danger. You can transfer COVID-19 even if you don't have any symptoms. Acute respiratory distress, heart injury, blood clots, and other COVID-19 complications can afflict anyone who catches the virus, especially those who are at a higher risk. However, it is unknown whether patients with psoriasis are more susceptible to these consequences. The limited evidence available suggests that their risk is no different than that of the general population. Psoriasis and long COVID-19. COVID-19 patients usually recover entirely within a few weeks. However, some people will experience symptoms or have a lengthy COVID after they have recovered. The term, long haulers, is used to characterize these individuals. Long COVID symptoms can last for up to 4 weeks following the initial COVID-19 diagnosis. COVID-19 symptoms are more likely to remain in older adults and people with major medical issues. Even younger, otherwise healthy people might get ill for weeks or months after contracting an infection. Long-term COVID symptoms may include fatigue, muscle and/or joint pain, breathing problems or shortness of breath, problems with memory or attention, coughing or chest discomfort, sleep issues, heart rate that is racing or hammering, taste and odor loss, anxiety or depression, dizziness, fever. Researchers are unsure if patients with psoriasis or other autoimmune diseases are more likely to have lengthy COVID. Some researchers have been looking into the link between COVID-19 and the development of autoantibodies that are comparable to the ones that cause psoriasis inflammation. Autoantibodies are immune cells that attack healthy tissues and organs by mistake. These autoantibodies have been established in studies to be a driving force in protracted COVID. While this study is beneficial, it does not address whether having pre-existing autoantibodies in psoriasis or other autoimmune disorders may contribute to more severe COVID-19. Furthermore, it gives no indication of how long COVID might influence a psoriasis patient. Even if there is an increased risk of long COVID in people with psoriasis, most patients with severe psoriasis are already taking drugs to minimize the inflammatory response of autoantibodies, which may reduce the risk of long COVID. COVID-19 with psoriasis treatments. COVID-19 is thought to be more prevalent among immunocompromised people. While this is most common in persons who are undergoing chemotherapy for cancer or who have poorly controlled HIV/AIDS, it can also happen to people who are taking drugs that alter the immune system's function. Psoriasis patients will take a variety of immunosuppressive medications, such as methotrexate, biologics, cyclosporin, and Janus kinase inhibitors. These medications can partially suppress your immune system, increasing your risk of infection. People who use immunosuppressive medicines should continue to take them unless they test positive or develop symptoms of COVID-19, according to current American Academy of Dermatology guidelines. Furthermore, current evidence reveals that persons with psoriasis, particularly those on biologic medication therapy, are not at an increased risk of getting COVID-19 as a result of their psoriasis therapies. According to the COVID-19 Task Force of the National Psoriasis Foundation, most psoriasis therapies do not appreciably affect the risks of getting SARS-CoV-2 or having a poorer course of COVID-19 sickness. Immunosuppressive therapies' effects on the immune system aren't a reason to discontinue taking it. Questions concerning your treatment plan should be directed to your doctor. They can also provide you the best advice on how the pandemic may affect your existing health state and treatment plan. Take the following CDC actions to reduce your COVID-19 risk. As much as possible, stay at home. When out in public, avoid crowds and limit direct contact with others. When you're out and about, avoid touching your face, nose, and mouth. When out in public, avoid touching regularly handled items like doorknobs and shopping carts. When you need to touch surfaces, keep disinfectant wipes on hand. When in a busy area, wear a mask. Consult your doctor to see if the COVID vaccination is right for you, and if so, get vaccinated as soon as possible. Wash your hands with soap and water for at least 20 seconds or use hand sanitizer after coming inside or after touching commonly touched surfaces. Psoriasis and hand washing. Washing or using alcohol-based sanitizers may be difficult for people with irritated skin or scaly plaques on their hands. Use hypoallergenic foamy soaps instead of those with strong abrasives or antibacterial ingredients. Make care to thoroughly rinse with water. After patting your hands dry, apply a thick, moisturizing cream to hydrate your skin. Vaseline and other petroleum-based moisturizers are excellent choices. If you notice that hand washing or moisturizing irritates your psoriasis-prone skin, consult your physician about alternative options. Psoriasis does not make you more susceptible to COVID-19 infection or consequences. Psoriasis patients who are on immunosuppressive medication should keep taking it. If you test positive for COVID-19, your doctor will let you know what changes you should make. People with psoriasis should have the COVID-19 vaccination. It, along with regular infection prevention measures, is the most effective strategy to avoid COVID-19. Thank you for watching Psoriasis on YouTube. Please be sure to like, comment and subscribe to the channel. I'll see you on the flip side.